What type of equipment do you need to acquire, purchase, or rent if your loved one is discharged from the hospital and is debilitated? Either they have decreased ambulation or they're bedbound. I'm going to go over this today. I'm Alan Bienstock, and I'm a board-certified plastic and reconstructive surgeon. I specialize in wound care for those that are homebound and bedbound and cannot go to a doctor's office or institution. So a lot of my patients that I see are generally homebound. Either they have decreased ambulation, which means that they require a walker or assistance to walk, and or they're bedbound, meaning that they're not able to move themselves. So many of these patients require various things. The most important thing I recommend is a hospital bed. Now, if your loved one has a pressure ulcer, which is a type 3 or type 4, which I'll get into another video, they're a good candidate for what's called a low air loss mattress. We'll talk about these specific mattresses in another segment. Your loved one will also require a wheelchair. Sometimes these can be specially fitted and designed based on if you've seen a physical medicine rehab doctor or physiatrist. This will be usually is covered by Medicare or other insurances, but takes several months to fabricate, to fix. It's usually made for your specific body type, your weight, and your distribution. Sometimes insurance will not cover the best models, which means you'll have to pay out of pocket. Other equipment are Hoyer lifts if you have difficulty transferring your loved one from a bed to a chair. Sometimes it will require different instruments such as Foley catheters, pulmonary equipment if you're requiring a ventilator, which means a tube that requires you to breathe. These are all things that are addressed by both the specialist as well as the primary care physician. Most of the time, you'll have either caregivers or nurses that will help manage this. The most important thing is to be on top of these type of equipment. Some things are very fancy and require a lot of skill and knowledge how to use and have enormous troubleshooting. I always recommend starting with the simple things first, like a simple hospital bed. There are much better beds that you can purchase or rent at a more exorbitant amount, but these require more work and understanding of how they actually work. I hope this is helpful, and if you have any questions regarding supplies, beds, and equipment that your loved one may need if they're homebound and bedbound, please leave comments below. And if you have any other questions, please reach out and subscribe to the channel when you get a chance. Thank you.